When we think about fighting cancer, our minds usually jump to medicine, new treatments, maybe the patient's own health. But what if one of the most powerful factors for survival has been hiding in plain sight this whole time? Buried in, of all places, the digital chatter of the healthcare system. So today, we're going to dig into this incredible study that used AI to find it.
So the researchers kicked things off with this really powerful question. They looked at data for over 500 patients with breast, lung, and colorectal cancer and asked, beyond all the clinical factors we already know about, what else could possibly be influencing who survives? And the answer they chased? It was pretty unconventional. They had this hypothesis that the key wasn't in the patient's body at all, but in the connections between the people caring for them. The answer, they believed, was hidden in the teamwork. Okay, let's get into how they did this. Instead of focusing on the usual stuff like age or cancer stage, the researchers turned to this massive, and I mean massive, untapped source of data, the digital footprints left behind in a patient's electronic health records, or EHRs. Just think about it for a second. Every single time a doctor, a nurse, or a pharmacist opens a patient's file, writes a note, or even just reads an update, the system logs it. This creates this incredibly detailed time-stamped record, a digital breadcrumb trail, really, of who's talking to whom and how information is flowing through the entire care team.
So now you've got this mountain of raw data. We're talking thousands of digital interactions for each patient. What do you do with it? Well, they decided to turn it into something visual, something understandable. They set out to create a unique communication map for every single patient's care team.
And they called this a collaboration network. Now, this isn't like a simple social network where Dr. A is directly linked to Dr. B. Nope. It's what's called a bipartite network. Basically, the healthcare professionals are connected through the documents they read and write. So a specialist writes a note, a nurse reads that note, and boom, that's the connection. That's how information and collaboration actually flows.
So here's how they did it step by step. For each one of the 505 patients, they scooped up all the EHR access logs. Then, they identified every single professional and every clinical note involved in that patient's care. And finally, they mapped all those interactions, creating this unique visual fingerprint of how that specific team worked together.
Okay, so you have these super complex maps, right? You need a detective who can spot patterns that are pretty much invisible to the human eye. So they brought in a special kind of AI called a graph neural network, or a GNN, which is just perfectly designed to analyze these complex network structures.
But, and this is super important, they had to be incredibly careful. An AI could easily cheat. It could just look at the last few months of notes, see signs that a patient's health is declining, and use that to predict the outcome. To stop that from happening, they created what they called a gap window. The AI was only trained on teamwork patterns from the first 9 months. This made sure its predictions were based on real collaboration signals, not on last-minute health problems.
After all that heavy lifting and careful setup, the question they gave the AI was actually incredibly simple, but also really profound. They just asked, looking only at the shape of this team's communication map, can you predict whether the patient is going to live or die?
And you know what? That AI detective, it absolutely delivered. As it sifted through all this complex network data for both breast and colorectal cancer patients, it found one pattern that was an astonishingly strong predictor of survival.
And get this, it wasn't a specific drug. It wasn't the involvement of some top-tier oncologist or a particular type of specialist. The answer was something much more fundamental to the way the team itself was built.
The answer was surprisingly straightforward. The single most influential factor that was associated with better patient outcomes was the active involvement of a general practitioner, a GP, in that patient's collaboration network. And this visual just nails the difference. I mean, look at this. On the left, for a patient who survived, you see the GP right there in the middle, acting like a central hub connecting all these different groups of specialists. Information is flowing everywhere, the team is coordinated. But then look at the right, for a patient who didn't survive. There's no GP, the collaboration is all broken up into these isolated silos. Care's just stuck in this one small group with almost no connection to the wider team. So, okay, this is a super interesting correlation, right? But the researchers had to prove it was actually significant. Just how powerful was this teamwork signal compared to the usual ways we measure these things? Well, the results were absolutely staggering. When they trained a model using only data on a patient's other illnesses, their comorbidities, it was okay, it had a decent accuracy at predicting survival. But, get this,
The model that used only the teamwork data, it was significantly more accurate. The way the team worked together was a better predictor of survival than the patient's overall level of sickness. Just let that sink in.
And of course, you might be thinking, well, what about other stuff? The researchers thought of that too. To make sure this wasn't just some fluke, they checked other common factors. And they found that things like the patient's gender, their age, their insurance type, and even the cancer stage showed little to no real correlation in their models. That teamwork signal, specifically the GP's involvement, it just kept standing out as the dominant factor. This finding is a really big deal. You know, this idea of shared care, where a primary care doctor helps coordinate everything with specialists, it's been a theory for a long time. But as the researchers say here, this is the first time it has been empirically supported with actual real-world data in cancer care. They've given us the data-driven proof for something doctors have kind of known intuitively for years.
So what's the big takeaway here? It suggests that the next big leap in improving cancer care isn't just about finding the next miracle drug. It might also be about optimizing the very human systems that deliver that care. And that leaves us with this really powerful question to think about. Instead of focusing only on the medicine, should we also be engineering better, more connected, and more coordinated healthcare teams? The data seems to be screaming, yes.